New day, new development. We heard yesterday that the National Sterilisation Program has been extended to run 24 hours a day in Dubai for the next 2 weeks. While trams and metros will be closed during the duration, Union Cooperative outlets, supermarkets, pharmacies and food and medicine deliveries will be allowed to operate. Also, all people leaving homes should now wear a mask and gloves despite what some of you all have read in other sites. Now that's just a quick update, but today what I will be doing is explaining what really happens to insurance policies in the face of a pandemic. Technically, healthcare policies will no longer respond to the treatment of a policyholder who has been diagnosed with COVID-19 due to policy exclusions, which recognize this change because, well, COVID-19 has now been declared a pandemic. In the UAE, services listed outside of the scope of health insurance by the DHA is treatment for all healthcare services for internationally or locally recognized epidemics. Now, this inclusion is designed, of course, to ensure that health insurance companies and providers will not face crippling and unsustainable losses in the face of a pandemic. The question then becomes whether the state will pick up the cost of care. Dr. Suzanne Robertson answered this on last week's AB Live. In this region, in Dubai and UAE, the wider GCC, have we seen that the involvement of private sector has been limited or restricted for some reason? Is that something that's happening on purpose?
I think, is this in relation to COVID and the management of COVID? Is
Correct.
That what the question? Okay.
Yes.
So I believe that in any country, the first step is at a federal level or at a government level to try and assess the situation. The second step or second stage is then to engage industry, local industry, in order to try and to manage.
Currently, approaches differ country to country. In Bahrain, for example, diagnosis and treatment of COVID-19 claims are being handled at a state level, either at quarantine sites or at the main government hospitals. Insurance companies are not involved once patients are diagnosed, and the state bears the cost. Similarly, in the UAE, Ministry of Health and Prevention has implemented instructions about when to seek medical attention from one of the main public hospitals or designated care units. In the US, meanwhile, the CDC has been covering the cost for COVID-19, while certain states, including New York, Washington, and Nevada, have ordered health insurance companies to waive copays and deductibles for coronavirus testing. Japan is now covering coronavirus screening through the country's National Health Insurance Program, which is administered by the local governments. Well, as you know, this story develops on an hourly basis, and we will continue bringing to you updates on ArabianBusiness.com. There is going to be a part 2 on this video about what insurance policies do and mean for businesses right now. So don't forget to hit that subscribe button and, of course, watch this space for regular news updates.